One of the advantages to having the hospital here is that all the services, all the healthcare services in Vulcan are under one roof. Because of that, we have great communication between all the disciplines, the doctor's clinic, the public health, home care, lab, x-ray. They're all centered under this roof, so we can just run down the hall and say, hey, this patient needs this, can you come see them?
I find that in the size of a community, for having everything together, the communication is a lot more like receivable, because everybody's in the same building. So we're able to communicate better, we're able to be more efficient. If there's questions, it's right next door, or it's right, you know, a phone call away. It's not something that we have to wait weeks to get a fax in, or, you know, to get a consult in. It's pretty much right there at our fingertips. And I find that makes for a much better healthcare system.
It's nice that we have the clinic here along with emergency acute care and long-term care. The doctors are always here during office hours, so it's not like you're calling them from across town and they have to come in.
Then here, it's basically just stepping from here to there, and even if there's a problem in the acute side with any patient, it's easy convenience, and you just pop in, and it makes everything, I would say, better for us physicians and for the patients, because then we're there on time when things go bad.
I feel like it works advantage for the patients here. It's very nice because we are able to think of all aspects of what we need to do for that patient, because we're so close with having x-ray right there, having the clinic right there, having the doctors right there. Everyone is quite involved in the patient's lives.
It's a lot more involved with the patient, and I think it's a lot more focused on the patient, so it's a lot more in detail, in depth, and I think it's giving the patient a lot more care and a lot more quality of care.
Absolutely. I think that a great strength of this community is to be able to have all these different services within one building. From an RN standpoint, if I'm in emergent and someone comes in with a wound or an incision or something that I know that's going to need follow-up care with home care, I can go over to home care and grab the home care nurse right then and there if she's in the building and say, you know, what do you think? What should we start with this? Because they're going to end up with home care. So we really collaborate and pull from one another.
So I think that in rural, we have that one big advantage of having really good communication and follow-through for our patients.
The building has everything under it, so with everybody working together, it just makes it for a much better system to have a better health care, a better feeling of confidence in your physicians and in your health in general, I think.